Hi, are you a chiropractor that wants to help more personal injury patients in your practice? My name is Dr. Calarco with PI Expert Secrets, and a common question that we get asked is, do I have to send PI attorneys cases in order to earn their referrals, in order to be able to treat their clients? And the short answer to that question is absolutely not. Look, can it help? Yes, of course. What attorney wouldn't want referrals, right? I mean, it's what they went to school for. It's their area of expertise. Of course, they would like more clients. They're going to be small business owners, in many cases, just like you are as a physician if you are treating in a private practice. But hopefully we all got into this profession, right, to help people, whether that's on the legal side or whether that's on the treatment and the medical side. So if you have fresh or unrepped PI cases that you can send over, to attorneys for representation, from your existing patient base, that can be through social media marketing. It can even be through specific states where you may have access to accident lists and any other referral sources. That can be fantastic. That can help. But really, at the end of the day, that's not going to make you stand out as a quality provider who gives the best care possible and actually does all the detailed analysis for each one of these injuries on each one of these cases. Those things that we discussed before, most of the time are not going to be consistent. There can be a variable number of referrals that you'll have to the legal community from your existing patient base. Digital and social media marketing can be hit and miss. Platforms do change algorithms, and most of the time, the things that you're doing that are working are going to have to be adapted or change over time as the actual platforms change, as people move to different platforms, et cetera. And then if you are in a state, let's say, with access to specific accident lists or anything else, where you are able to get specific information regarding patients who may need your services, those rules and regulations change. And to be frank, there's not many states in the US where you're actually going to have access to that kind of material. So what you really need at the end of the day for a long-term dialed-in strategy is going to be quality patient care, case management, case building, and really the list goes on. You need to understand the nuance outside of the actual treatment process, because you all out there who are watching this, who are physicians, who are chiropractors, are going to be musculoskeletal experts. You're going to understand, what you need to do in your clinic to help that specific patient. But more so than that, you need to focus on the factors that maybe are outside of your control, or things that maybe you haven't thought about before. And one of those things, again, may be the inconsistency when it comes to getting those unrepped cases. That's a factor you can't control. What you can control is how well your patients respond, what kind of marketing you do to the legal community, how well your actual communication will be between your team and the legal team for those patients that are involved in auto accidents. So again, it's going to be really important to focus on those factors that you can control, the things that are going to be consistent, the things that are going to bring real value. So will a case, let's say, that needs to go to an attorney for representation bring value to that attorney? Sure. That's a new client that they can help. But at the end of the day, the real value is going to come from the attorneys, from the legal community, from the patients, working with physicians who understand personal injury treatment, understand those injuries, understand the importance of objective evidence of injury, understand quality documentation when it comes to personal injury specifically, and then know how to tie it all together with proper case management and case building. So this way you are corresponding and saying the correct things with the legal firms, you are well-versed in depositions and trials, and you have built up long-term relationships because of the quality outcomes you've gotten, not only from your treatment, but the way you document that treatment and the way you communicate that treatment. I do think we get this question frequently because there are probably two main reasons, why physicians feel like they maybe need to send referrals back to a specific law firm, in order to get PI patients back. And I think some of it, and maybe the first reason, is because if you're a physician out there who has not done a lot of PI treatment, has not seen a lot of auto accident injuries, you may not know exactly where to go, how to communicate, how to document those things, because there is a difference between your normal patient base and those PI-specific injuries. Not so much in the treatment, but in the way they're documented, in the way they're communicated, and really how you're bringing things together and keeping the legal teams and those who are representing those clients up to date on everything. And that's going to require probably a level of communication that you're not normally doing with your health insured patients. And the second reason is probably, some of you out there, if you're docs and you've met with attorneys, they might be a grizzled vet. They might be a attorney that's used to, getting their way, leveraging physicians and telling them that, look, we're not going to have our clients treat with doctors who don't refer us business, who don't, again, do the things that we need to do. The idea, though, is that the mindset here is going to be important. Never let an attorney, never let anybody in the legal community push you around. Any quality attorney, and that's most of the legal community out there, are going to want to position themselves as attorneys that work with quality physicians. Those quality physicians are going to have to know how to, again, treat that specific auto accident pathology, work with others in the medical community, whether that's specialists, surgeons, or anybody else that can get proper treatment modalities for that patient's specific needs. And then knowledge and implementation, again, of those specific processes that deal with PI specifically is going to be important. So at the end of the day, I wouldn't really be too concerned about how many referrals you can send back to the legal community. You need to position yourself as an expert in this space. And the more well-versed you are when it comes to personal injury treatment, communication, management, and building of that specific case based on quantifiable, objective evidence of injuries and the things that you need to notate, document, and do are going to make you stand out in the long term. And that's how doctors all over the country, chiropractors specifically, that want to do more personal injury really can see their numbers grow exponentially over time. So we hope you found this information helpful. Again, my name is Dr. Calarco with PI Expert Secrets. Go ahead and check us out for more information like this. Cheers.